from last 5 days, I'm feeling very happy, I'm relaxed and peaceful. So you have given me a life back. I'm going to join with you. I'm going to join. So I was having.
Hello, hi, namaste, good evening, everyone. If you can see me and hear me, type S in the chat box. If you can see me and hear me, type S in the chat box. Perfect, perfect. Thank you so much. Quickly type it in the chat box. Which city are you joining from? Which city are you joining from? Thank you so much for being here on time. Before time, I can say that means you're the most serious people in this workshop. Karthi is from Mysore, Madhuri is from Pune, Kolhapur, Hyderabad, Chennai, Amritsar, Nagpur, Bangalore, Hyderabad, Mumbai, Chennai. Tulsi is from Hyderabad, Devika is from Mumbai, Ranga is from Bangalore, Belgavi, Vishakhapatnam, Ahmedabad, Bellary, Vijayanagaram, Pune. We are planning a retreat in Pune. Divya, Hubli, Guntur, Mumbai, Bengaluru, Thane, Chennai, Mysore, Mumbai, Hyderabad, Anantapur, Vadodara, Bengaluru, Mumbai, Coimbatore, Bangalore, Chennai. Wow, we have people across India, dear friends. People across Delhi, Nagpur, Gaya, Sweden. We have people joining from Sweden abroad. Himachal Pradesh. Niharika, thank you so much for joining from Sweden. Anybody joining from abroad? Hubli, BHEL, Bengaluru, Ongole, Coimbatore, Lagos. Wow, thank you so much from joining from Lagos, Muraliji. Awesome. So thank you so much, dear friends. Thank you so much for being here, California. Wow. Thank you so much for being here on time before time. This is going to be one of the powerful workshop, I'm telling you. One of the powerful workshop. By end of this workshop, the way you breathe will be completely different. The way you breathe will be completely different. Before I go forward, I would like to ask you all, how many times do you eat in a day? Approximately how many times do you eat in a day? 3 times, 4 times, 5 times. Any foodies who eats for 6 to 7 times? So maximum I can see is 5 times, 6 times, 7 times also I can see. Got it. Maximum 7 times. Got it. How many times do you drink water in a day? 10 times, 15 times, 20 times, 20 plus times. Got it. Maximum 20 times, 20 to 25 times. Got it. How many times do you breathe in a day? Not countable, no idea. 24/7, smiley, impossible to count. 17,000, unstoppable, continuous, no idea. Uncountable every time, countless, 24 hours, 21,800, 8,000. God. You're eating maximum of 5 to 6 times in a day. You're drinking water maximum of 20 to 25,000 times in a day. Average human being breathes between 21 to 25,000 times in a day, dear friends. You have given enough attention to the food you are eating, water you are drinking. Have you ever given any attention to the breath you are taking? What is the quality of your breath? What is the quantity of your breath? What is the depth of your breath? Whether you are breathing correctly or not? Breathing wrong leads to various range of health disorders, respiratory disorders, cardiovascular diseases, brain problems, digestive problems, and many more. By simply changing the way you inhale and exhale, you can solve majority of your health problems, dear friends. That is what research says. Today we are going to work on one of the fundamental aspects. Human body needs only three things: food, water, and air. We are working on the third element, which is air, dear friends. Hope you all are ready. So before I go forward, I just wanted to read out some ground rules. What are the ground rules I want each and every one of you to follow, so to make this session successfully and peacefully, so please make notes and share it in the group. Finish what you start. It's easy to start something, it's easy to quit something. It's difficult to take it to the finishing line, dear friends. Ask questions at the end. Whatever questions you have, please ask them at the end. Participate fully, no distractions. Session lasts for 90 minutes. This session is for 90 minutes. Actually, we promised only 20 minutes breath flow. You might be thinking only 20 minutes class. To teach that 20 minutes class, we have to teach you why you are doing what you're doing, what is the reason behind each and every exercise, how to implement each and every exercise. That is what we are going to learn. So then only you'll be able to understand and remember and go like take it deeper, this knowledge. If that is okay with you, type okay in the chat box. Yes, 20 minutes breath flow you will be learning, but the reason we are taking 90 minutes is to explain you why we are doing, what is the reason behind, what are the benefits of this and everything. Perfect. And no recordings available, so please do not ask for the recordings. There were no recordings available. We will not be giving any recordings. Please make notes. What will you learn? You learn about breath awareness, 10-point evolution, toxic removal techniques, required lifestyle modifications, digestive wellness system, gut-friendly breathing exercises, activating your inner healing powers, and I'll be playing flute meditation for all of you tomorrow. So why breathing, dear friends? Out of many things, why am I talking about breath? Breathing is a pillar of your health. It's literally a pillar of your health, dear friends. When you can't breathe, nothing else matters, given by American Lung Association. You can live 2 weeks without food, 2 days without water. You cannot live more than 2 minutes without breath. What is the most essential thing in your life? Food, water, or air? Type it in the chat box. If you don't have for next 10 minutes, you don't have life. What is the most essential thing? Exactly. 70% of the toxins will release through your breathing. If you are not breathing properly, those toxins are getting accumulated in your body and turning as disease, including cancer. The toxic materials. Life process is functionally operative till the vayu or life forces in the body, dear friends. Imagine there is a dead body next to me. Both of us has body, both of us has hair, both of us has skin, nose, mouth, eyes. What is the difference? What's the difference between me and dead body? Exactly. Dead body can't breathe. Dead body can't breathe, dear friends. What is the first thing they'll put when you go to the oxygen, like when you go to the IC room? Oxygen mask. Why? Until we breathe, doctors can do anything. The moment we stop breathing, they can't do anything with this body. This body is no of use. No use. Oxygen is one of the best detoxifying agent, dear friends. If I ask you a silly question, how many of you are breathing? What do you say? I am breathing, we all are breathing, right? So don't stop breathing, of course. Don't stop breathing. So this session is not about breathing, dear friends. You are already breathing. It's about channelizing your breath. Whatever you are doing already, how to optimize it, how to do it in the better way. It's about breath flow, the channelizing the flow of your breath. That is what we are going to do, how to do it efficiently. The flow of breath should be, this is what we are going to achieve in these 2 days. The flow of breath should be uniform, rhythmic, long, slow, and deep. What are the factors that disturbs oxygen flow? Is shallow breathing, mouth breathing, breath holding, rapid breathing, irregular breathing, incomplete exhalation, and chest dominance are some of the factors that disturbs oxygen flow into your body. Right? So breath flow is a system which I have developed to make your breath prana rhythmic, healthy, long, slow, and deep. Long, slow, and deep, dear friends. Before I go forward, can I introduce myself? Who am I? Why am I doing all of this? With your permission, type S in the chat box if it is yes. Okay with all of you. Thank you so much. I am from Telangana. Telugu వాళ్ళు ఉన్నారు ఎవరైనా? Great. So it was a year 2005. I was in my 8th grade. Dear friends. I was an underperforming student in my school. There was a lot of pressure from my parents, my school, my teachers. Every day I used to live with fear. That fear got accumulated and turned as asthma, dear friends. Since then, I was on medication, visiting the doctors, taking the pills. Out of 365 days, I used to have running nose for 30 days. My parents took me to the best of the best hospitals, best of the best doctors in Andhra Pradesh and Telangana. None of them were able to help me. None of them were able to help me, dear friends. At the end, doctor said, I need a surgery. I was panicked, my parents were panicked, the deviation is happening. During that time, I found breathing and meditation classes in my university. I did not want to go for medication and all. I just went there and started practicing whatever they were teaching. After 6 months, I went to the doctor again. Doctor said, there is no need of surgery. He said one more thing. There is no need of medication, dear friends. That day, I felt like it was my rebirth. I was born again on this planet. Until that time, I was just surviving my life. I do not know when my breathing will stop. The reason why am I doing what am I doing, dear friends? I suffered for 8 years. Whatever I have suffered, I was able to recover within 6 months by activating my inner healing powers, by implementing natural healing methodologies. I wanted to share all of those things with you as well. That is my mission. Today, my mission is to create anxiety-free, medicine-free India by using breath healing method. I do not want any one of you to suffer what I have suffered for 8 years for not knowing the simple techniques and methods. How many of you want to be part of this mission? Type M in the chat box if you want to be part of this mission. Thank you so much. So what you are learning is a life skill which is going to help you and your family and people whom you are associated with also. So after that, I have done a lot of certifications from various gurus, Dr. Hansama, Blair Singer, Padmasri, Makan Gundechar, Maiti Desai. I done certifications from Baba Saheb Ambedkar University, Kaivalya Dhamma, Yoga Institute, Heartfulness Institute. Deep gratitude to all my teachers. Because of them, I am here today. And I also got certified by Ministry of Ayush Government of India as a wellness instructor, dear friends. And I followed the same templates what South Indians follow. Complete their graduation, go abroad, start earning money, start working over there, study over there. I followed the same template. And while I was in Europe, I started spreading this knowledge. I represented India in Netherlands as well as in Italy. I had students from 52 different nationalities. I have also given a radio show at Radio Roma Capitale in Italy. In Italy at Radio Roma Capitale, dear friends. So this is what I have done. And before I go forward, like next segment, I wanted to tell you that how this session is going to play a huge role if you really learn and implement each and everything and start being aware of your breath. I'm telling you how it is going to play the huge role. I just wanted to show you a couple of people how they transform their health after going through this workshop. So Prabhjot came to this workshop. He thought whether this will work or not. He was suffering with anxiety, fear, back pain and gastric issues. Within 1 month, everything is gone. Back pain gone within 15 days. For another student, his resting heart rate has come down from 73 to 58 within 3 weeks. For another student, she is a COPD patient. Her lung capacity got improved from 58 to 64% by just implementing right way of breathing. For Srinivasanji, his acid reflux gone, palpitations gone, blood pressure has become normal, shortness of breath is gone by just implementing right way of breathing, dear friends. That's the power of breath. Prana, that's the life energy, biological energy. So dear friends, I wanted to tell you that this session is not to cure your thyroid, not to cure your high BP, not to cure your digestive problems, not to cure your asthma, not to cure your diabetes or blah blah blah. This session is to cure what is causing those problems. What is causing those problems? We are not here to work on the disease. We are going to work on the root causes of the problems. What is causing? We are not addressing the root. We are just taking the symptom. If that is okay with you, type okay in the chat box. How much ever fertilizer you put on the tree to get a quality fruit, you will get only chemical fruit. But if you work on the roots, you will get a quality fruit. Whether you want to work on the roots or work on the symptom, it's up to you. But this program is not for the symptom. This program is to work on the roots. So the secret number one we are going to learn. Secret number one we are going to learn is breathing health self-assessment, dear friends. How many of you here would like to know the mistakes you are making while you are breathing? Without you knowing that, there is no use of learning any technique. There is no use of, even if you learn the technique, you will do it mistakenly, you will do it in the wrong way, you will get negative benefits. How many of you here would like to know the mistakes you are making while you are breathing? Perfect. Thank you so much. So what I am going to do is I am going to ask you 5 questions. For each question, 0 to 4, what is the score you would like to give? 4 is the highest, 0 is the least. For this, we need a pen and paper. So please be ready with your pen and paper. If you are ready, type ready in the chat box. So let me turn on the timer. Perfect. Thank you so much. So I'm going to turn on the 1 minute timer. The first question I'm going to ask is, what is your breathing rate? How many breaths do you take in 1 minute? Okay. So just count number of inhalations. Do not change the way you breathe. Do not close your eyes. If you close your eyes, you become conscious. Just normally how many you are taking. Just count them. Okay, the timer starts now. Start counting. Stop. So what is your score? Santosh 34, Seema 21, Bharadwaj 14, Amruta 31, Varun 18, Rahul 10, Kondal 33, Pooja 30, Prema 26, Reena 13, Rajiv 12, 18, 60, 22, 30. Got it. Let's see, where do you stand? Is your breathing rate within the normal range? What is the normal range? 12 to 15 breaths per minute. If it is 15 or less than 15, give 0 marks. Sorry, 4 marks. Sorry. If it is 15 or less than 15, give 4 marks. If it is above 15, give 0 marks. If it is above 15, that means you are over breathing. You are breathing a lot. Hyperventilated. How overeating is harmful, over breathing is also harmful. Okay? You should not over breathe. So if you are breathing above, if you are taking above 15, give 0. If it is under 15, give 4 marks. 15 or under 15, give 4 marks. Next question. Yeah, only inhalation. That means one breath, right? Inhalation and exhalation is one breath. Place a palm on your belly. Breathe in. Breathe out. Tell me, while you are breathing in, while you are inhaling, is your belly coming out, going in, or no movement? If it is coming out, type O. If it is going in, type I. If it is no movement, type NM. No movement. For Soma, it's coming, going, going in. For Tuk Tuk, it's coming out. For Samsung, it's going in. For Preeti, it's coming out. For Kondal, it's no movement. For Prasanna, it's going in. For Reena, it's coming out. For Arun, it's coming out. For Lata, it's no movement. For Ranjita, it's no movement. For Sujata, it's coming out. For Rajendran, it's coming out. For Bhavana, it's no movement. For Rajkumari, it's going in. For Srinivas, it's going in. For Ganti, it's no movement. For Maria, it's coming out. For Imtiaz, it's coming out, going in. Got it. So what's the correct answer? For Dheeraj, it's coming out. Our lungs are like balloon. When you blow the balloon, what happens? It expands. The belly should come out, dear friends. If it is going in, that means you are breathing wrong. You are having dysfunctional breathing, which leads to various range of digestive issues, lung health, and many more. So if your belly is coming out, give 4 marks. If it is going in, 0 marks. If it is no movement, 0 marks. Third question. Posture. Throughout the day, are you sitting upright or are you slouching? Are you sitting upright or are you slouching? So for example, if you're slouching, when you're slouching, you're compressing your lungs. You're compressing your lungs. Can the air enter here? Consider this is a water pipe. If I'm pressing the water pipe like this, can the water flow down? Right? Dear friends, if you're not allowing the lungs to breathe properly, if you're slouching, give 0 marks. If you're sitting upright, give 4 marks. If you're doing both, you can give whatever score you would like to give, 0 to 4. Okay? Whatever score you would like to give. Next question. Mouth breathing. Do you sometimes breathe through mouth as you go about daily activities or during sleep? Even during the sleep. If yes, a big 0. Mouth breathing is one of the worst breathing habit, dear friends. Everyone, please remember. Show me your nose. Repeat after me. Nose is for breathing. Show me your mouth. Repeat after me. Mouth is for eating. Can you eat with nose? Then why are you breathing through mouth? There is a purpose God has given nose, right? So unless you have a blocked nose or if your nose is not working, then you can use your mouth. Right? So if you are breathing through mouth, give 0 marks. If you are breathing through nose, give 4 marks. Fifth one, shortness of breath. Have you ever experienced shortness of breath, especially during the physical activity or while at rest? If yes, 0 marks. If no, 4 marks. Perfect. So what is your full score? Type your full score in the chat box out of 20. If you're having shortness of breath, 0 marks. If no, 4 marks. Oh my god, chat box is buzzing. Like Prithvi 4, Mansi 0, Satya 10, Dheeraj don't know, Anand 12, Varun 5, Amruta 4, Chakrapani 16, Amog 14, Karthik 8, Soumya 8, Dorairaj. So I lost. Okay. So let's see where do you stand. Rajendran 18, Panja 4, Vinay 8, Redmi 4. Got it. So let's see where do you stand. If your score is less than 10, that means you are in red zone. Red zone. Your breathing quality is not at all good. You're not breathing properly. Your body is not getting proper prana. Anytime you can face any challenges. If you're between 11 to 17, you're in amber zone. Anytime you can fall into red zone, you both don't know how to breathe first. For you to get the benefits out of this, first you have to learn how to breathe. If you're above 17, you are doing super good green zone. Be proud of yourself. But if you still have any health issues, you should learn how to channelize your own breath to heal your body, heal yourself. Others, they don't know how to breathe only. Right? How many of you found this segment useful? Type useful in the chat box before we go to the next. Awesome. Shortness of breath means breathlessness. Thank you. So now this is a breathing health diagnosis. Now you know the mistakes you're making. Number 2 is belly is coming out or going in. Okay. So yeah. So belly movement. So belly should come out. So I hope the perfect. Thank you so much. Great. So if you found it useful, type useful in the chat box before we go to the next one. Perfect. No problem. Great. Thank you so much. So dear friend, Shalini ji has implemented the right way of breathing for 30 days. She's feeling more energetic, having sound sleep. And she even lost 4 kgs by just implementing right way of breathing. She even lost weight, 4 kgs. She was overweight and she lost. And Vijay Ji, she was having pulmonary hypertension pressure, pulmonary hypertension of 90 plus. After implementing right way of breathing, it came down to 58. And for Kinner, snoring problem gone, anxiety gone, immunity has increased, improved sleep quality, lung strength has improved, enhanced concentration, and stress got elevated by just implementing right way of breathing, dear friends. This is the power of breath. Mastering the breath flow can help you to reverse many diseases. So this is an important slide. Please note it down. There are 3 important conditions to improve the oxygen flow in your body. The first one, the respiratory passage must be clear. The respiratory path from your nose to your lungs, the path has to be clear. If the pipe is not clean, will you get the clean water? If the pipe has leakages, will you get the proper flow of the water? No, right? So same here. Respiratory path. Second condition, the respiratory muscles must be strong. The respiratory muscles which is supporting you in your breathing, thoracic muscles, clavicular muscles, intercostal muscles, diaphragm muscles, back muscles, all of this. And third condition, the lungs must be healthy, dear friends. The lungs must be healthy. So we all consist of 3 vital bodies: gross body, subtle body, and castle body. We have 3 bodies. Before I go forward, I want to ask you all one question. How many of you here went to the doctor? Doctor did all the tests. All your reports were normal, but you don't feel normal. How many of you here like that? Wow, so many people. Reports are normal, but you don't feel normal. But got it. And second condition, you went to the cardiologist, he asked you to go to the pulmonologist. You went to the pulmonologist, he asked you to go to the neurologist. You went to the neurologist, he asked you to go to the psychologist. You went to the psychologist, he asked you to do that test, this test, this test, that test. How many of you are here going to different doctors, wasting your time, wasting your money? Yes. How much money have you spent? Right. To know that you don't have any health issues. Actually, like people, if doctor says you don't have any health issues, you have to celebrate. Your problem did not turn into physical problem. 80%, like 90% of the problems are only in the mind, not in reality. People suffer 95% in their mind only, not in reality. So the problem is in the mind, most of the, yeah. So let's understand the gross body difference. So for example, doctors has tested in your gross body, like gross body is like a mobile phone. And they said like some of you may have physical health issues, some of them doesn't have health issues. Let's understand. For example, you have mobile phone. Is this useful without software? Is this useful without Android or iOS software? Is this useful? Which is a subtle body. The problem might be in the software. Pranamaya, Manomaya, Vijnanamaya. Okay, you have mobile phone, you have software. Is it useful without battery? The problem might be in the battery, which is castle body. So these 3 bodies are divided into 5 koshas, pancha koshas, dear friends. The first kosha is Annamaya kosha, physical body made up with anna, the food we eat. Sense organs, interaction with the external world, physical shit happens here. Second one, the Pranamaya kosha, the energy body with the life force, breath, subtle psychological processes, energy circulation happens here. Then we have Manomaya kosha, mental body, thoughts, emotions, memories, ego, desires, everything happens here. Then we have Vijnanamaya kosha, intellectual body, discrimination, intuition, intellect happens here. Then we have Anandamaya kosha, the bliss body, pure bliss, transcendence, spiritual awakening, connection with universal consciousness happens here, dear friends. Which level did you feel stuck? Type in the chat box. 1, 2, 3, 4, 5. All levels, Manomaya kosha, Annamaya kosha, Manomaya kosha, Pranamaya kosha, Manomaya, Pranamaya, Manomaya, Pranamaya, Manomaya, Anandamaya, Annamaya, all koshas, Pranamaya and Manomaya. God. Many of them are saying Manomaya kosha. Imagine a person has anxiety. The person who has anxiety, it's 100% guarantee that he will also have gut health issues. Gut health. Annamaya also got affected. The person who has anxiety, his breathing will be irregular, faster, shallow. Pranamaya also got affected. The person who has anxiety, he can't think properly, make decisions properly. Jnanamaya also got affected. The person who has anxiety, is he happy? Is he bliss? Ananda? Ananda also got affected. How many of you agree if one affects, everything affects? Everything is interconnected. Yes or no? Exactly. How many of you would like to heal in these 5 areas? Type 5 in the chat box. From now, we will be starting Annamaya. That means physical healing. Tomorrow, end of this workshop, by end of tomorrow's workshop, you will be at Anandamaya Kosha. You will be at Anandamaya Kosha. So dear friends, do you know the capacity of our lungs? The capacity of our lungs. The capacity of our lungs is 5.9 liters for men, 4.5 liters for women. Do you know how much we breathe usually? 500 ml, which is less than 1/10 of our lung capacity, dear friends. Less than 1/10 of our lung capacity. 90% of the waste is eliminated through your lungs. We use only 30% of our lung capacity, dear friends. 30% of our lung capacity. Our bodies are filled with toxins because of multiple reasons. If you want to reach your goal, you should have a healthy body, not a sick body. What we are going to do right now, we are going to do some exercises. For example, what happens due to wrong breathing habits, shallow breathing habits? There are so many dormant regions in our lungs which are unutilized. Which portions? Those portions we are not using. So right side we have 3 lobes, left side we have 2 lobes of the lungs. So due to shallow breathing, wrong breathing habits, we don't utilize. When we do these exercises, we will be able to utilize this maximum level. And also we are going to focus on increasing the efficiency of your respiratory health by using respiratory muscle training. We are going to train the different respiratory muscles to improve your breathing capabilities. The focus here is to improve the depth of your breath, amount of your breath, to strengthen the muscles around your lungs, and to increase your lung capacity, to give the freeness of your breath, to help you to able to breathe more. So dear friends, before we go to the exercises, Dr. Stephen Lin said, there is one factor above all that can extend your life expectancy. It's your lung capacity. If your volume of lungs decreases, the risk of dying heart failure drastically increases. Because when we are aging, lung capacity gets reduced. So when we are able to maintain, we'll be able to live healthy because of prana. This is a platform for your prana, the life energy, the biological energy, right? So now we'll start our some exercise practical aspect also, whatever we have learned. How many of you are finding it valuable so far? Type value in the chat box if you're finding it valuable. Interesting. Great. Thank you so much. Thank you. So now, before we go forward, what happened? I want all of you to come on camera so that I can see you properly. I know that, dear friends, you have paid 99 rupees, but I want each and every one of you to attend like as if you have paid 9,999 rupees. How serious you will be. What I am sharing is my 10 years of experience. Even now I am learning. It's not that I have arrived, but after working with 70,000 plus people, 10 years of experience I am teaching. Thank you. Perfect. So now, what happens usually, like whenever I ask anyone to start and do any breathing practices or anything, they put lot of tension in their neck, shoulder region. Because of that, like they don't utilize, the oxygen exchange will not happen properly. The oxygen supply or the prana flow will not happen properly. Because the moment you put tension, the blood flow gets affected. Blood is a carrier of oxygen, right? Blood is a carrier of gases. So first we'll talk about in terminology of oxygen and all of this. Like tomorrow we'll come into the prana, the concept of prana, right? So that is the reason this tapping technique will help you to release the tensions and improve the blood flow into your body. So let us start the first exercise, the tapping technique. Stretch your left hand forward. Make a cup with your right hand. Start tapping. Tap, 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 tap. Turn your palm, tap, tap. Relax, 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 relax. Thumb up, relax, relax, relax. Opposite hand. Turn your palm. Thumb up. Down. Tap it in your chest. On your belly. Your back. And tap it on your neck. Use your fingertips. Tap it on your face. Relax. Tap it on your head, top of the head. Back side of your head, sides of your head. And relax. Very good. Next, one more thing you need to remember while you're doing these practices is keeping your spine erect. How to keep your spine erect? Interlock your fingers. Stretch your both hands up, lengthen your spine. Look forward while exhaling, hands down. So try to maintain this erect position. For example, if you have back pain or if you're having severe lower back pain, take a back support. It's completely fine if you take a back support, and also do not overdo. Listen to your body. If your body is saying that it's paining here and here, take a rest. Take a back support, take a support of the wall and practice. Or if you want to lie down for some time, you can lie down for 2 minutes and come back again. Okay? So please listen to your body. Do it as per your capacity. In our classroom, we have people from 10 years to 80 years. Everyone's capacity is different. Everyone's energy levels are different. What you are going through in your life is different, right? So that's why it's not that like, oh, I have done for 20 times, you also need to do 20 times. Please do it as per your capacity. Listen to your body. Do not injure yourself and follow my instructions carefully while I am giving. Now we'll begin. So what was the first condition? There are 3 important conditions to improve oxygen flow into your body. What was the first condition I have told? A quiz, small quiz. I just told now. If you forgot, then how can I expect you remember for tomorrow? Very good, Bala. Awesome. Respiratory path, not tapping, not posture. It's a respiratory path. There are 3 important conditions to improve your oxygen flow. What was the first condition is respiratory path. The pipe must be clear. Got it. So the first exercise which we are going to do, this is the little toughest exercise of all the exercises which I am going to teach. Who should not practice this? Because it's a cleansing practice, detox practice. This needs a little effort. But who should not practice this? If you're having heart problems, high BP, hypertension, if you are suffering with ulcers or severe lower back pain, or if you are a menstruating woman, pregnant woman, you should not practice this. Pregnant women, menstruating women, if you are having high BP, hypertension, blood pressure, or if you are having ulcers, severe lower back pain, that means acute pain, and if you have any abdominal inflammation, please do not practice this. Okay? So how to do this? First one we are going to do is a Shodhana Kriya. Right? If you also have doubts about this practice, you also don't practice. It's okay, like only one exercise, right? How to do this is, we have to close one nostril. We have to inhale and exhale. Active inhalation, active exhalation from opposite nostril. Until where? Only until here. You should not inhale up to here. You should only inhale up to here. Because we are cleaning the path. Right? So these muscles has to be engaged. The clavicular muscles. Do not engage your belly. Your belly will engage in the beginning. It's okay. But try not to engage the belly. Try to engage the clavicular region. Just observe me how I am doing. See my neck muscles. I am breathing to my neck. Okay, neck region and clavicular region, not to my belly. So try to do that. You can place a palm here so that you can see the movement is happening here or not. Initially the belly moves, it's okay, but try to engage this part more. Quick inhalation, quick exhalation. Just let me show you the sound also, how the sound looks. Like this. 10 times right side, 10 times left side. So again, change the nostril. Quick inhalation, quick exhalation 10 times. Head straight, neck straight. Change. Keep doing Srinivas. Change. No, kids under 10 years, no. They should not practice this. Under 12 years, you can say. Keep repeating. Change. Change. And relax. Keep your eyes closed, normal breathing. In case if nostril is blocked, it's completely fine. You can avoid the practice or you can do as per your capacity. Relax yourself, normal breathing. Shodhana Kriya. Focus on your breath. And slowly open your eyes. Shodhana Kriya, name. So one of the common mistakes people may put is they put a lot of tension in their neck. Make sure you're not putting any tension in your neck region. They tighten. Like I have observed that some people are tightening this region. Do not tighten this region. Just relax. Relax your body and do it slowly. In case if you cannot do it like that speed, you can do it slowly. But you have to understand that the inhalation and exhalation, rapid inhalation, rapid exhalation. Both inhalation and exhalation are active. In some exercises, only exhalation is active, not inhalation. So in this exercise, both inhalation and exhalation are active and with one nostril. And do not press other nostril tightly. You have to gently close the nostrils. Okay? And next exercise. So what was the second condition I have mentioned? So this is for respiratory path mainly. Initially the belly moves, it's okay. So slowly how to practice, you need a more practice. See, dear friends, when you go to the dance class, on day one, can you dance like Hrithik Roshan? But with practice, yes. So same, everywhere practice is required, dear friends. You can't expect everything to be learned on one day or 2 days. So you only when you practice, there is a use of this workshop. You can't get 6 packs in 2 days. Can anybody teach 6 packs in 2 days? Like they can teach you, but make you like get 6 packs in 2 days. Please let me know. I also need their contact. I also want 6 packs. Who doesn't want if somebody can able to help to get 6 packs in 2 days, right? So it's only like this will help you to learn these things. You have to learn more. You have to refer some books, and you have to learn from somebody, or from us, or you can even learn from anywhere else. So next, respiratory muscles. Very very good, Arunachi and OnePlus and Memo. So how many lobes we have on right side? Activating the lobes. 3 lobes. Some of them are typing 2. How many are on left side? 2 lobes. Why 2 on left side? Because of the heart. Just to accommodate the heart, there are only 2 lobes on left side, and right side we have 3 lobes. So as I said, due to wrong breathing habits, shallow breathing habits, there are so many dormant regions in our lungs which are unutilized. These exercises will help you to activate the different lobes of our lungs. Now we are dividing our lungs into 3 lobes, and we are going to activate the different lobes step by step. Okay, so while we are doing this, one thing you have to remember, dear friends, where your focus goes, if you want to note it down, where your focus goes, the prana flows, the energy flows, or that grows. If your focus is going towards YouTube, YouTube will grow. If your focus is going towards Instagram, Instagram will grow. If your focus is going towards Amir Khan, Amir Khan will grow. If your focus is going towards you, who will grow? You will grow. Exactly. Right? So your focus is the most important aspect, because when we are engaging the lower lobes, some people will say that where is my lower lobes? How can I feel that lower lobes? Well, only when you bring that concentration, you will be able to feel. Initially, it's a little difficult, but you will be surely able to feel your lowers. Yes, it's a great example, right? So yeah. So first we are going to activate the different lobes. For that you have to focus on the first lower lobes of your lungs. Lower lobes means the under, the last lobes. Interlock your fingers, palms on your chest. While inhaling, stretch your both hands forward. While exhaling, palms on your chest. Follow my speed now. Inhale slowly, focus on lower lobes. Exhale slowly. Inhale through your nose. Exhale through your nose. One of the common mistake people make, inhale and stretch. No. While inhaling, the coordination of movement and breath should happen together. While exhaling, the coordination of movement and breath. Okay? Breathe in. Breathe out. Look forward, head straight, spine erect. Inhale slowly. Focus on the lower lobes. Neck relaxed, shoulder relaxed. Exhale slowly. Focus on the lower lobes. Breathe in through your nose. Breathe out through your nose. Keep practicing. Let me see how you are doing. Inhale slowly. Do not hold. Do it slowly. Head straight. Keep doing, Krishnaveni ji. Ram Prasad ji, slowly. Inhale, stretch your hand slowly like this. While exhaling, slowly bring back. Some of them are stretching slowly but bringing back very quickly. Then you are not having the breathing rate should be equal. You are not doing the equal breathing. Don't focus on tummy, focus on the lower lobes. We are not using the tummy here. We need rhythmic breathing. For that, you have to inhale equally, exhale equally. Do not overstretch. Do it as per your capacity. Breathe in through your nose, breathe out through your nose. Last time, breathe in, breathe out. Everyone can practice this. No limitations. All of you can practice this. Please practice. Last time. Exhale, relax. Very good. Next, we are going to engage the middle lobes of our lungs. Right? For this, we have to stretch our hands 135 degrees. That means forehead level. Forehead level. Breathe in, stretch your hand. Focus on the middle lobes. Breathe in, stretch your hands in forehead level. Breathe out, palms on your chest. If you feel pain, relax yourself and do it. Reduce the repetitions. If you're feeling like pain, shoulder pain, hand pain, please reduce the repetitions. Do it only for few times. Might be your shoulders are not ready. Breathe in, stretch your hands. Breathe out, palms on your chest. Focus on the middle lobes. Head straight, Rajesh ji. Keep your head straight, neck straight. Keep practicing. Do it as per your capacity. Lungs, Dheeraj. Krishnaveni ji, keep doing. Keep doing, Krishna Kumar ji. Forehead level. Stretch your hands in the forehead level. Keep doing until I stop you to do. Puranjay, keep doing. Don't do it as a punishment, dear friends. Some of them are elderly people, like you are sitting like your parents has asked you to sit in front of camera and do this, right? So you're acting like a child. So like in my childhood, my father used to push me like, go to that class, go to this class. Because of him, I used to go, not because I like, right? So now people are doing the same. You need to have self-motivation. Rajendra, keep doing. Last time. Breathe in, breathe out, relax. Very good. Next, we are going to engage the upper lobes of our lungs. Only this region. You have to engage this region. Don't engage your belly and other parts. Only upper region, upper lobes of your lungs. Okay. For this, we have to stretch our hands 180 degrees. 180 degrees. Let's do this. Breathe in, stretch your hands above your head. While exhaling, palms on top of your head. Inhale slowly. Exhale slowly. Breathe in. Breathe out. It's okay, yawning happens because you are tired. That's a good thing only, right? You are releasing parasympathetic nervous system, relaxing hormones getting released. Breathe in. Breathe out. Inhale. While inhaling, it should come out, it should expand. While exhaling, it should contract always. Remember, because we are putting a pressure. Breathe in. Breathe out, neck relaxed. Inhale. So if you are feeling tightness, just do it 2 to 3 times. It's okay. With practice only, it will become normal. Right? I can understand. See, Archana ji is trying her level best. Right? So you have to try whatever you can. It's not mandatory. As I said, everybody's energy levels are different. You might be doing gyms, and your shoulders has become tight. Then how will you breathe if your shoulders are tight? How will you expand your lungs? Then you are not utilizing your upper lobes of your lungs. Especially this part of the lungs, people don't utilize. Right? So inhale up, exhale down, breathe in, and while exhaling, relax. Very good. If you want, if you're feeling pain, just roll them backwards, forward, roll your shoulders backwards and forward so that you will feel relaxed. Okay, so that all these muscles are tight. Your muscles are tight. You're blowing, and how will this expand if you don't loosen this? Right? So you can't breathe more, you can't breathe better, you are not allowing the platform, the prana, to breathe more. So no problem, Asraji, I can understand, but you are trying your best, right? So take rest if you want and do some normal shoulder rotations. Now I want all of you to stand wherever you are. Please stand up wherever you are. Let's do few more exercises. Without pain, no gain. Okay, so you are working in a company, that's the reason you are getting money. You also need to do some work, then only you'll get results. So first activate our body, shake your hands, jump on your toes, activate. Relax. First we are going to work on the right side, the right lobes, and also the rib cage of this body. For this, raise your right hand above your head, breathe in and breathe out towards your right rib cage, towards your right chest. Observe the expansion and contraction of this region. Do not bend your elbow. If you are doing like this, you don't feel anything. Stretch your hands. Stretch your hand up. You have to stretch this part. When you are lengthening your hand, you will be able to stretch your right rib and everything. And now slowly bend towards your left side and breathe in and breathe out towards your right rib. Again, do not bend your elbow. Inhale, center. Exhale, hand down. Now opposite hand, breathe in. Raise your hand up, lengthen, breathe towards your left rib cage and left chest. Inhale slowly, exhale slowly. Breathe in, 1, 2, 3. Breathe out, 1, 2, 3. Make it rhythmic. Breathe in slowly. 10 inhalations, 10 exhalations. Slowly bend towards your right side. Again, breathe in towards your left rib. Breathe out. Inhale, center. Exhale, hand down. Very good. Now, place your left palm on your right shoulder blade. Right shoulder. Left palm on your right shoulder. Right hand behind you. Wrap your right hand behind you. Slowly, while exhaling, twist towards your right side. Breathe in and breathe out towards your left chest. Breathe in and breathe out towards your chest region. Five times inhale and exhale. Inhale. Inhale through your nose, exhale through your nose. Now slowly come to the center and release, relax your hands. Now opposite hand on opposite shoulder and wrap it behind your left hand behind and twist towards your left side. Now breathe towards your chest, left chest mainly, towards your heart region. Breathe in towards your heart. Breathe out, relax. Inhale for 3 seconds, exhale for 3 seconds. Exhale and slowly come to the center and release your hands. Next, we are going to practice intercostal breathing. For this, place your 4 fingers on your ribs, on your rib cage. I'm coming forward and I'll show you where to place, not on your waist. Many people are placing here. Place it on your ribs. 4 fingers on your ribs, thumb behind your ribs. Okay, do not press, gently place the hands over there. Do not press them. Now breathe in towards your rib cage. Observe my ribs. Breathe out, relax your ribs. Inhale slowly, observe them. Exhale. Your ribs are moving sidewards and upwards. Sidewards and upwards. So keep doing that. Place your both hands. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Breathe in slowly. Breathe out slowly. Inhale. Exhale. Breathe in. Breathe out. Inhale. Do not force, do it as per your capacity. Head straight. Namrata ji, keep your head straight, neck straight. Head straight, look forward. Keep your eyes closed if you want. Keep doing, Prithvi. If you want to take rest in between, you can take rest. Ajender, keep doing. Last 2 more times. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Slowly release your hands. We'll repeat one more time. Same exercise. 10 times. Place your 4 fingers on the ribs, thumb behind your rib cage. One of the powerful breathing exercise, intercostal breathing. Breathe in towards your ribs. Breathe out, relax your ribs. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Do not put any tension on your neck and shoulders. Neck relaxed, shoulder relaxed. Observe the expansion and contraction of your ribs. Last 2 times. Breathe in. 1, 2, 3. Breathe out. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Slowly release your hands. Observe the changes. And gently open your eyes. I know you might be finding stiffness. Slowly lift your both hands up. Inhale, lift your both shoulders up. Back. Exhale down. Inhale, front, up, back, down. Front, up, back, down. Breathe in, up, back, down, and front. Back, up, front, down, back, up, front, down, back, up, front, down. Turn your head towards your right side, center, left side, center, right, center, left, center. Bend towards your right side, center, left side, center. So please relax, have a seat wherever you are. How are you feeling, everyone? Type in the chat box. How are you feeling? Go to everyone and type in the chat box. It's magic, Nilofer says. Yes, it's really magic. You were able to breathe more. Great, relaxed, better, nice, great relief, calm, relaxed, feeling lungs for the first time, Rahul says. Superb feeling, fantastic. Relaxed, dry, conscious breath. Feeling good. Shoulder pain, it's okay. My heart feels light. Phlegm coming out of the lungs. Wow. Wow. Awesome. Awesome. Thank you so much, dear friends. Thank you so much. I want to know, like, see, it's not about relaxation. Any breathing you practice, you feel relaxed. I want to ask you all, how many of you are able to breathe better now? Type better in the chat box. How many of you are able to breathe more now? Type more in the chat box. How many of you are able to breathe deeper now? Type deeper in the chat box. How many of you are able to breathe longer now? Longer, Longer, longer. You're able to breathe slowly and longer. Your breath has become longer. How many of you are able to feel your breath? Connect with your breath and observe the expansion here. Muscles got engaged. Something has happened here. How many of you are feeling this? Exactly. So this is what this is what I want all of you to expect. The purpose of this is this, dear friends. The purpose of this exercise is to feel this, to release the stiffness in this region, allow the muscles to engage, breathe properly, and everything. Right? So yes, movement in ribs. So now let's move to the, like, what will happen if you practice like this for 30 days? Burning in the chest should not happen. If it is happening, you have to check with the doctor first, right? If there is some problem. So like, what will happen if you follow this for 30 days? Exactly, right? So it will completely transform ourselves. This is what happened for Paramashiva, dear friends. He has implemented right way of breathing. His sinusitis problem got fully cured. Gut health also improved. And he lost 2 kgs. He's feeling hair growth. He's feeling bit of hair growth also. Anita ji went through my 30 days lung fitness challenge. Her chronic migraine got disappeared within 30 days. She was suffering with migraine for the past 20 years, gone. And for Rani Mukherjee, she was having severe neck pain, headache, shoulder pain, and severe anxiety issues, gut issues. And she could recover from most of it by just implementing right way of breathing, dear friends. No anxiety now, no gut issues now. Sudarshana, she was suffering with headache and neck pain for the past 6 months. She was able to cure after, like within 30 days after going through this program. Like just her headache gone, neck pain gone. How many of you, before we go to the next topic, the important topic of Pancha Pranas, how many of you would like to stay connected with me for rest of your life? Thank you. How can we stay connected? We are more than like around 900 members. We can't stay connected over WhatsApp. It's not practically possible. That's the reason I have created a YouTube channel, dear friends, where I have kept all the content readily available for each and every one of you completely for free of cost. I recommend every one of you to click on this link and subscribe to the YouTube channel. Once you are done, type done in the chat box. So this is where we can stay connected. Whenever I put new content, you will also get notified. You will also get notified about all my new content and everything. I hope all of you are following me on Instagram also. You can also follow me on Instagram so that I am very much available. We'll be putting a lot of content on Instagram and we can stay connected through Instagram also. These are the two platforms we both can stay connected for longer time in the lifelong. Okay, so this is an Instagram profile. Perfect. Now next we'll go to the next topic, one other important topic. Dear friends, once you are done, type done in the chat box. Yes. So dear friends, there was a lot of research happened how breathing exercises also influences on your digestive health. For example, slow deep, there was a research published, slow deep breathing intervention improved the symptoms and alter rectal sensitivity in patients with constipation and predominant IBS, irritable bowel syndrome, people who are having this, right? So dear friends, we have five vayus, pancha vayus, like in our body, everything. Like for example, how your eyes are getting blinked, how the voice is getting produced, from where are you getting the thoughts, how the digestion is happening, how the extraction is happening. There are different pranas responsible for different functions in our body. These are pancha pranas, right? So what we take is a prana vayu. Of course, we are taking to the chest, but this divides into other four vayus. There are many pranas, but these five pranas are main pranas. The first one is udana vayu, which is an upward moving energy. Can you all see this purple color one? Throat to head. The udana vayu, which flows towards the sahasrara chakra, the top crown chakra. It's an upward moving energy which is responsible for your speech, memory, balance, and mental strength. Mental strength, dear friends, and intelligence. That is udana vayu. Then we have prana vayu, which is in your chest region. Prana vayu is like a neutral gear. Udana vayu is a reverse gear. Samana is gear 1, apana gear 2, vyana is gear 2, gear 3. Right? So prana vayu, which is responsible for vitality, respiration, circulation, and thinking capability. Right? So if you are having any imbalance in prana vayu, you will be having these problems. So then we have samana vayu. Can you see this yellow color one? In your stomach region, belly region. So which is responsible for digestion, distribution, assimilation, and nourishing of your food. Sorry, nourishing of your body, not food. Nourishing of your body. So like if you are having any imbalances here, then we have to work on samana vayu. Then we have apana vayu, which is in your pelvic region. It's a downward moving energy towards the Mooladhara chakra, the root chakra, which is responsible for excretion, the movement, urination, menstruation. Then we have vyana vayu, nerves, heartbeat, circulation, joint, muscles, everything happens here. Everything happens here, dear friends. So like prana is a force, right? For example, even if a person, after person dies, the oxygen is there in the air, sorry, in the atmosphere, in the planet, but the person don't have a ability to breathe in, breathe out. What is helping you to breathe in, breathe out is what? Prana. I hope you got it, right? So tell me which prana, which vayu do you have imbalance? 1, 2, 3, 4, 5. Which vayu do you have imbalance? It's very common, Prashant. Pranavayu, Samanavayu, Samanavayu, Pranavayu, Prana and Samana, Apanavayu, Pranavayu, Udanavayu, Samana Udana, Pranavayu, Vyanavayu. Got it. Now you know which vayu do you have imbalance in your body, right? So there was a lot of research happened, dear friends. This is one of the research I have taken from Kaivalya Dhamma. How breathing influences breathing exercises influences on different systems of your body, whether it is digestive system, respiratory system, circulatory system, lymphatic, muscular, bone, joints, urinary, genital, endocrine, nervous, and skin. Right? So when you practice breathing exercises, immediately you will see these benefits. Immediately. Then when you practice for 2 to 3 weeks, when you practice for 6 weeks, you will see these benefits, intermediate benefits. When you practice for 6 months, you will see long-term benefits, long-standing effects. How many of you want long-term benefits? Type LT in the chat box if you want long-term benefits. Of course, everyone. It's very simple, dear friends. If you want long-term benefits, you have to work long-term. There is no other choice. There is no other choice. If you want long-term benefits, you have to work long-term. So let's take circulatory system. When we practice breathing exercises, it will help you to reduce your heart rate. Blood pressure comes down, improves the regional microcirculation, relaxes the smooth muscles, improve the coronary circulation. But when you practice it for 6 weeks, cardiac cycle become rhythmic, improvements in stroke volume. Then when you practice for 6 months, you'll see improved tone of smooth muscles, improved health and efficiency of electrical nodes. So many people ask me how breathing is connected with the digestive system. How can I cure digestive problems? How many of you have this question? Type I in the chat box. Let's see. So when you practice breathing exercises, for example, like before I answer this, tell me, what do you need for your food to digest? What do you need for your food to get digested? Water, oxygen, acid, Jataragni, fire element, enzymes, bile, saliva. You all are correct. You all are correct. Tell me, can Agni exist without Vayu? One of the important component, you all agree, Agni. Can Agni exist without Vayu? Can water exist without air? Without oxygen? No. One of the important component we need for your food to digest is oxygen, dear friends. Right? So breathing exercises will help you. Like the moment you eat food, the blood flows towards your stomach. Oxygenated blood will help you to extract the nutrient and supply to the whole body properly. Proper metabolism also happens. Right? So that is what I am teaching. How is it connected? Right? I am teaching. So when we practice breathing exercises, there will be a proper supply of oxygen towards your blood, and it improves your digestive function, it improves your metabolism. So there is a diaphragm muscle. How many of you agree? How many of you know that there is a muscle, diaphragm muscle here, which divides your lungs as well as your stomach? If you don't know, diaphragm muscle is one of the important muscle in your body. When we practice breathing exercises, we activate this diaphragm muscle. We allow this diaphragm muscle to move. Due to shallow breathing habits, wrong breathing habits, many people breathe to chest. They don't breathe towards the diaphragm. When we are practicing breathing exercises, it will help you to engage your diaphragm. It stimulates your digestive organs. There are so many digestive organs which is supporting in your digestive function. So all these organs get massaged, and it secretes proper. It helps you to secrete proper digestive juices and improve your digestive function. Right? So because your diaphragm is pushing down, belly is coming out, and all the massage of all the organs also will happen. So tell me, where does the digestion start from? The digestion starts from your mouth. Exactly. Saliva plays an important role in your digestion. Breathing exercises will help you to improve your saliva production, dear friends, which has a lot of growth hormones, digestive enzymes, and many more. If you don't believe, just observe tomorrow. Come to tomorrow's class. When you practice breathing exercise, observe that whether saliva production secretion is happening or not. So dear friends, how many of you heard this nerve called vagus nerve? This is one of the longest nerve in our body. The longest nerve in our body, which is connected from your brain stem to your gut. When we practice breathing exercises, it will help you to stimulate your vagus nerve, improve your digestive function, dear friends. Improve your digestive function. Right? So also it connected with other organs also. It's connected with other organs as well. So dear friends, we have autonomic nervous system which is doing all the activities, which has two nervous systems, sympathetic and parasympathetic nervous system. Due to our lifestyles, our sympathetic nervous system is more dominated. When we practice breathing exercises, it will help us to activate our parasympathetic nervous system. Sympathetic nervous system is responsible for activity, fight or flight. Parasympathetic nervous system is responsible for rest and digest. Your digestion happens during parasympathetic nervous system is active. Your breathing exercises will help you to activate your parasympathetic nervous system, improve your digestive function. Does any doctor told you all of this? So by simply taking the medicine for acidity, how will you solve your problem? Constipation. The problem is somewhere else. Tell me, is there any medicine to cure acidity, constipation, IBS, IBD, ulcers? Tell me, is there any medicine to cure COPD, ILD, asthma, sinusitis, bronchitis, TB? Tell me if there is any medicine to cure thyroid, migraine, sleep problems, insomnia, anxiety, heart palpitations, high BP, diabetes. Tell me if there is any medicine I will buy and distribute it to all of you for free of cost. Medicines can only suppress your symptoms, dear friends. Medicines can only suppress your symptoms, they cannot cure your problem. When we are born, at least they are doing that. We have to be thankful to them. Actually, they are doing that. So when we are born, did we have all these health issues? We got these health issues in the process of our life. We created these problems. Only we can work on removing these problems, dear friends. Unless you work on the root causes of these problems, you are not going to solve these problems. It will be only symptomatic treatment. That's why when people come here and ask me like, how can I cure my asthma, how can I cure my diabetes, again they are talking about symptom. They're not ready for cure. They are not ready for reversing their health issues, right? Exactly. So if you want to know about other health issues, like that's why I want with this I would like to conclude today's session. So if you want to know anything else about muscular bone joints, take a screenshot of this and read by yourself. You have ChatGPT, you have Google, you can research by your own. I can't take each and every system because of lack of time. You can take the screenshot and you can do by your own. You can do that homework before you come to tomorrow, how it is going to help in muscular or bone joints or etc. Okay, so what we are going to learn tomorrow, dear friends, with this I would like to conclude today's session. Tomorrow I want each and every one of you to practice whatever you have learned today, especially the practical aspect. Please do practice. And tomorrow I'm going to teach you some of the powerful breathing exercises. If you miss tomorrow, I think you are missing one of the important segment of your life. I'm not saying only the session. If you are here, there are so many thousands of people have seen our ads. Only these 1,000 people are here. That means this is not an accident. It's like maybe the God has planned this for you. So if you are missing tomorrow's session, that means you are losing one of the opportunity to take care of your health. Because you know what happened during the COVID situation. Many people used to come and tell me, if I would have known you before, I would have saved my father. I would have saved my mother. They used to tell me. So now now you have an opportunity. And tomorrow I'm going to play flute meditation for all of you. How many of you want to be part of flute meditation? Type I in the chat box. And also I'll discuss what's next tomorrow. What's next also tomorrow. And also, dear friends, I want each and every one of you, like I know that you all have question, so each and every one of you to practice it before you come to tomorrow's session, so that you will be able to like today's main session is mainly focused on respiratory muscles and activation, the Annamaya Kosha. Tomorrow we are going to do more on Pranamaya, Manohamaya, Vijnanamaya Kosha levels. Okay, and I'll answer all your questions. How many of you found today's session valuable, useful? Is it worth your time? So if you really found it useful, I want all of you if you really found it like how many of you would like to help us to